morning students, welcome to another class. In the previous class we have discussed the first top 50 questions. Now let's read more. Now question number 51. In Bohr's effect the curve shifts to left when? Oh, actually in Bohr's effect the curve does not shift to left. There is a little problem. It should be the curve shifts to left in oxyhemoglobin dissociation curve. Alright, this is a little error in the typing. Let's see. Now we have discussed what happens in oxyhemoglobin dissociation curve. This is the partial pressure of oxygen and this is the percentage saturation of hemoglobin with oxygen. Now at about, at the lungs at about 104 mmHg, almost 100, 97% is saturated, hemoglobin is saturated with oxygen, right? And at tissue level, that is at about 40 mmHg, it is still 75% loaded with oxygen, the hemoglobin, because only 25% is delivered. So how much is delivered? Only this much, 25% is delivered to the tissues. That means this much has dissociated. Now left shift means you are standing like this. This is right shift, this is left shift. Left shift means something like this. So even lesser is going to dissociate. That means oxygen and hemoglobin will share a more close bond. You don't need even 25% oxygen to be given to tissues. The tissues must be less active metabolically. Less CO2 must be getting produced. Less H ions. That means pH must be rising. It should be alkalinity that is happening. When less metabolism, less heat is generated. So temperature should be less. Like in fetal hemoglobin. Fetus hemoglobin should have more affinity for oxygen as compared to maternal hemoglobin. That is why it can take oxygen from maternal hemoglobin. Like in myoglobin, this stores only one oxygen atom, unlike hemoglobin which stores 4, but it stores more tightly. That is why myoglobin curve is like this. So still on the left side. So all these are the conditions where the shift of curve will be to left side. That means more association of oxyhemoglobin, less dissociation, less is transferred to the tissues. So left shift will be in this condition. If CO2 increase, CO2 increase, pH decrease, then in these conditions what will happen? pH decrease, PO2 decrease. All these are conditions where there will be right shift. That means Bohr's effect. Alright. So left shift is less CO2, less temperature, less H ions, pH increase, then it is left shift. Bohr's effect is right shift. Now, alveoli become enlarged and damaged with reduced surface area in chronic heavy smokers. This condition is called emphysema. We know in emphysema the alveolar walls are damaged. So, surface area for respiratory exchange of gases reduces and there is a problem in breathing. Silicosis is what? It is an occupational lung disorder in which there is fibrosis of lungs. Asthma, in this there is difficulty in breathing that produces wheezing sound and this is an allergic disorder. Bronchitis is inflammation of bronchi, again difficulty in breathing. But where the surface area of alveoli is reduced, that happens in emphysema, particularly in chronic smokers. Now, what happens in hamburger or chloride shift? Now students, this is related to CO2 transport. We have discussed that this is a tissue cell, suppose CO2 is getting produced. Here this is blood, this is a RBC, this part is the plasma. Alright, now CO2 goes inside the RBC, attaches, combines with water in the presence of carbonic anhydrase enzyme, forms H2CO3 and then this breaks into bicarbonate ions and H ions. This H ion will combine with hemoglobin which has released O2 into the tissues. But this bicarbonate, the CO2 in the form of bicarbonate will come out into the plasma. And from the plasma, because one negative charge has come out, chloride, one negative charge will go inside. So chloride is going from plasma into RBC. Bicarbonates are coming from RBC into plasma. This is chloride shift or Hamburger phenomena. So bicarbonates move out of RBC and chloride enters into RBC. Alright. Answer is option A. Related to CO2 transport. 70% of CO2 is transported as these bicarbonates through the plasma. Now, a chemosensitive area is situated adjacent to rhythm center in the brain. Rhythm center is in medulla, respiratory rhythm center. But close to it, there is a chemosensitive area. This is highly sensitive too. We know, students, that chemoreceptors are sensitive to increased PCO2, increased H ion concentration. Wherever the arterial blood that is coming, that will only be filtered into cerebrospinal fluid. That will reach medulla through that fourth ventricle, you remember, that is present in medulla, that contains CSF. So if in the arterial blood there is more CO2, tissues are more active, more CO2 is getting produced, or somehow CO2 is not getting out of the body. So if in the arterial blood there is more CO2, in the CSF there will be more CO2, more H ions. This is detected by chemosensitive areas. And then they cause faster breathing, they reduce the inspiration of duration of inspiration. We breathe faster so that this extra CO2 is flushed out. So they are sensitive to CO2 and H ion concentration. They are not sensitive to less PO2. They are sensitive to more PCO2 and more H ion concentration. Very, very important. Alright. And so there will be faster breathing to flush the CO2 out. Now, universal donor and recipients are. We know, students, that universal donor is O negative. It does not have A antigen, B antigen as well as RH antigen, and universal recipient is AB positive. So donor is AO and recipient is AB. This is the answer, not this. Because they have first asked donor, then recipient. If in the question they ask universal recipient and universal donor are, then answer will be AB and O. But here answer is O and AB. This is donor, this is recipient. Best blood group to be given is A to A, B to B, AB to AB, O to O. But if not available, then, or if you don't know the blood group of the patient, you can always give O. Because there are no antigens. So, reaction always happens between donor antigen and recipient's antibodies, but there are no antigens in O blood group. So, no reaction will take place, no mismatched blood transfusion will happen. Now, what will happen if Rh positive blood is exposed to the blood of Rh negative person? Rh positive means, it could be A positive, B, AB, O positive. Rh positive means on the surface of RBC there is Rh antigen. That means no antibody against this Rh antigen in the plasma. It has Rh antigen. Rh negative blood means no antigen Rh and no antibody. Antibody is not there, whether it is Rh positive or Rh negative. Now, they are saying that if Rh positive is exposed to the blood of Rh negative, Rh positive person is exposed, Rh positive is exposed to Rh negative. That means you give Rh negative to Rh positive, then what will happen? Nothing will happen. If you do this, then the immune system of Rh negative will receive Rh antigen, it works against it and forms antibodies against it. That is going to form a problem. But if you are giving Rh negative blood to Rh positive, then there is no problem because there is no antigen coming into this blood, no antibody coming into this blood. So there is no problem at all. Nothing will happen. You remember erythroblastosis fetalis? Many questions comes on that. Mother should be Rh negative, father should be Rh positive. First fetus is always safe, but subsequent fetus, if Rh positive, will be unsafe. So when Rh negative blood receives Rh positive, that is a problem. But Rh positive is receiving Rh negative, that is not a problem. That is why AB positive is universal recipient. Positive can receive from positive, negative, any blood. Answer is C. Now, blood without corpuscle. Blood is what? Plasma plus corpuscles. RBC, WBC, platelets. So, blood without corpuscles means plasma. And if you remove fibrinogen also, it is not going to clot, it is serum. Right? Answer is option B. serum does not clot. What is lymph? Lymph means blood minus RBC and platelets, but WBC will be there. Some of the plasma protein, some of the fibrinogen will also be there. So lymph clots, but slower than the blood because it has less plasma proteins. But serum is totally without all the three types of corpuscles, totally without fibrinogen. Answer is B. Now, bicuspid valve is present in between. It's a direct question. Tricuspid between right atrium and right ventricle. Bicuspid or mitral valve between left atrium and left ventricle. Semilunar valves are present between right ventricle and pulmonary artery and left ventricle and aorta. These valves are very, very important. Answer is option C. Now, SA node is called pacemaker of heart because we know in the conducting system of heart, our heart, frog's heart is myogenic. The nerve impulse is generated within the cardiac musculature. SA node is the pacemaker. Then comes AV node, then bundle of His, then right and left bundle branch, and then finally Purkinje fiber, which supplies each and every cell of ventricular wall. SA node is the pacemaker because it initiates the contractions of heart and it maintains the rhythm at 72 times per minute. So answer is option B for Delhi. Which blood vessel carry blood from the heart to all the organs? Arteries. Aorta rises, it's the largest artery, divides into arteries, arterioles, capillaries. Capillaries exchanges the nutrients, CO2, everything with the tissues. And which blood vessels carry the blood towards the heart? It is the veins. So students, it is not important, please note, questions come on this concept that artery will always carry oxygenated blood. Artery is any blood vessel which is carrying blood from heart to the organs. Like pulmonary artery, from right ventricle of heart to the lungs. It is carrying deoxygenated blood, but it is going away from the heart. So it is an artery. Like pulmonary vein, it is bringing blood towards the heart from the lungs. It is carrying oxygenated blood, but it is bringing towards the heart, so it is a vein. So vein which carries blood towards the heart, artery which carries the blood away from the heart. So answer is option B for Bombay. And capillary is the thinnest blood vessel, only single layer. Artery and vein have 3 layers. Now, determination of cardiac output is done by, what is cardiac output? It is the amount of blood that is pumped out by ventricle in 1 minute. Stroke volume is in 1 beat how much blood ventricle is pumping. In 1 beat it pumps 70 ml and it beats 72 times per minute. This is the heart rate. So in 1 minute how much will it pump? 70 multiplied by 72, almost 5 liters per minute is the cardiac output. So stroke volume and heart rate both determine. If you increase the stroke volume, increase the heart rate, cardiac output will be increased. Or if you reduce, it will be reduced. So it is determined by both. CO is equal to heart rate multiplied by stroke volume. Answer is D. Now match the columns. We'll always go by the options. A can be 1 or 3. Let's see. P. P wave is what in an ECG? P wave means atrial depolarization, excitation of atria. SA node is firing. Atrial contraction it is denoting. So P is 1 and not 3. Now we will focus on B. QRS. This is QRS. QRS means, this is R. QRS means when the ventricles are contracting, ventricular depolarization. So QRS is 3, B is 3. This is the answer. And what is T wave? T wave is repolarization of ventricle or ventricular coming back to its normal position. So T is this, right? And one very important concept on which question comes, if you want to find out how many times the heart has beaten in 1 minute, take an ECG of 1 minute, calculate number of QRS, that will give you the pulse or heart rate. Alright? So answer is B. Now, which of the following excrete nitrogenous waste as uric acid? Reptiles. We know amphibia and human. Adult amphibia like frog, toads and human, they are ureotelic, they excrete urea. Tadpole of frog is ammonotelic. Reptile, birds and land insects like cockroach, they excrete uric acid. Ammonia requires maximum water, uric acid least water. Ammonia is most toxic, uric acid is least toxic. Let's see the next question now. In juxtamedullary nephron, what happens? Now we know there are two types of nephrons, cortical and juxtamedullary. Let's quickly see them. Now suppose this is cortex part, this is medulla part. In cortical nephron, the glomerulus, this tuft of capillary, the Bowman capsule, the PCT is in the cortex part. Loop of Henle is mainly in the cortex part, a little is in the medulla part, and DCT is also in the cortex part. And then this will be the collecting duct, receiving many DCT. This is a cortical nephron. And of course, there will be this peritubular capillary network, but there is no vasa recta, or it is less developed. What happens in juxtamedullary? Juxta means near. It is near medulla. So here, again glomerulus is in cortex, same. Bowman capsule is in cortex, same. PCT is in cortex, same. But loop of Henle starts in cortex but dips very deep into medulla. And again DCT is also same in cortex. And this is the collecting duct. And here also there will be this peritubular capillary network. But one branch is parallel to loop of Henle. This is the vasa recta. Right? So, vasa recta is prominent, yes. Loop of Henle is short, no, it is very long. It lies in cortex, no, it dips deep into the medulla. Peritubular capillary network is absent, no. It is present in both, whether cortical or whether it is juxtamedullary. So, answer is option A. It is responsible for concentration of urine. The longer the loop of Henle, the more concentrated urine is. Now, GFR in healthy individual is approximately, GFR means amount of filtrate that is produced by all the nephrons in both the kidneys in 1 minute. So this glomerulus is, this arteriole is bringing the blood, oxygenated blood from renal artery. How much it is filtering into Bowman capsule by all the nephrons in both the kidneys in 1 minute, that is GFR. It is 125 ml per minute or 180 liter per day. But only 1 to 1.5 liter is the urine produced. So remaining 99% is reabsorbed. You should know where there is maximum reabsorption, which substance is reabsorbed from which part. This is all very, very important. Now, JG cells are activated to release renin in response to. We know wherever there is a blood volume fall, blood pressure fall, there will be a fall in GFR. That stimulates juxtaglomerular apparatus, that releases renin. Renin is an hormone, it goes into the blood. In the plasma, it converts angiotensinogen into angiotensin 1. That gets converted into angiotensin 2 by lung alveoli enzyme, angiotensin converting enzyme. And this angiotensin 2 is active, it releases aldosterone from adrenal cortex. And then there is sodium and water reabsorption and the blood volume and GFR increases to become normal. So renin is released whenever there is a fall in GFR. Alright. Students, this is again very important. Lot of questions are asked on JGA, on RAS system and on ANF. So please revise that very, very properly. Now, which of the following statement is true with respect to muscle fiber? I band is present in the middle of sarcomere. What is a sarcomere? Suppose this is A band, the myosin, and it is bisected by this M line. And these are the I bands, actin, and they are bisected by Z line. So this is one sarcomere. So I band is not in the center. In the center it is the A band. H zone is present in the middle of A band. Yes, this is the H zone, the area of A band which is not overlapped by actin. That is H zone. Z line is present in the middle of H zone. No, it is the M line. Z line is present in the middle of I band. So correct answer is option B. H zone is the comparatively lighter zone present in the middle of A band where there are no actin fibers. Now, the region at the ends of A band of two adjoining sarcomere. Now suppose this is A band, I band. this is one sarcomere. Two adjoining sarcomere means this is another sarcomere, suppose. This is one sarcomere, this is second sarcomere. Now they are saying the region at the ends of A band. Ends of A band, this is what? I bands. Right? M line is here, Z lines are here, H zone is in the center. So at the ends, it is the I band having only actin filaments. A band has myosin plus little overlapping actin also. Now, during skeletal muscle contraction, following happens. We know what happens. This I band, this actin filament slides towards the center of A band. So A band is constant, I band shortens, so sarcomere shortens, H zone shortens. I band shortens, A band constant, H zone shortens. So the only correct is that sarcomere shortens. This is true. All others are false. A band constant, all other things shortens. And the length of actin and myosin will be same. They are just sliding. Actin is just sliding over myosin. Now, ribs that are attached to the thoracic vertebrae dorsally. All the 12 pair of ribs are attached to the 12 thoracic vertebrae and ventrally not connected to sternum. We know the first 7 pair are directly connected to sternum by hyaline cartilage. They are true ribs. The next 3, 8th, 9th and 10th pairs are connected to 7th rib and thus indirectly connected to sternum. But they are connected indirectly. But they are saying they are not at all connected to sternum. That is the 11th and 12th, the last 2 pair of ribs, not connected ventrally. They are free ventrally. They are floating ventrally. They are the floating ribs. Students, this is very, very important. True, false and floating ribs. Lot of question comes. The first 7 pair, the next 3 pairs and the last 2 pairs. The floating rib function is to to protect the kidneys. Alright? Very, very important. Now, the gaps between two adjacent myelin sheath is called. Now, we know this is axon. Whether it is myelinated nerve fiber or non-myelinated, they always have these Schwann cells. In non-myelinated, they don't produce myelin sheath. In myelinated, they produce myelin sheath. Now, myelin sheath is a insulator because it is phospholipid, sphingomyelin. And there are gaps in this myelin sheath which are called nodes of Ranvier. Student, exchange of ions can take place. Sodium ion coming in, potassium ion going out, depolarization, repolarization, all that can happen only at nodes of Ranvier. If there are no nodes of Ranvier, if this is a continuous myelin sheath, there will be no conduction of nerve impulse. So they are very, very important. They are called nodes of Ranvier. Very, very important, this myelinated concept. Now, in resting stage, the axonal membrane is. We know in the resting stage, inside is negatively charged, outside is positively charged. Intracellular potassium ions are more, extracellular sodium ions are more. How this charge develops? Inside negative and outside positive, because the membrane is impermeable to sodium ions, so no sodium ions are coming inside, no positive charges coming inside. Partially permeable to potassium ions, so potassium is going out, positive is going out, so negative develops inside. More permeable to potassium, impermeable to sodium, and also impermeable to negatively charged proteins inside the axon. Answer is option D, line of NCERT. Now, during conduction of a nerve impulse, the action potential results from the movement of. We know second stage depolarization, which produces action potential plus 30 millivolt. It is because sodium channels open and sodium comes from extracellular fluid into the exoplasm. So, sodium ions from ECF into ICF. That causes depolarization or action potential. What causes repolarization? When potassium moves from inside the cell to outside. This is repolarization. This is depolarization. And resting stage is maintained because of sodium potassium pump. So this is very, very important topic. Answer is D. Now, hypothalamus controls all. Thirst center, satiety center, it is called thermostat of the body. It regulates posterior pituitary directly, anterior pituitary indirectly. So it is master of master gland. All other functions. Option D. Arrange the following layer of cells in the retina of eye from outside to inside. We know outside there is sclera, then there is choroid, and then there is retina. In retina, if we see, outermost there will be photoreceptor rods and cones. They are attached to bipolar neurons. That is attached to ganglion, and those ganglion then forms the optic nerve. This. Outside to inside. If they ask you inside to outside, it will be ganglion, then bipolar, then photoreceptor. Answer will become C then. So we have to be very, very particular whether they are asking outside, inside or inside, outside. Answer is A. Now, blind spot is called so because, now we know, suppose, this is, I am drawing a very rough diagram. This is choroid layer, ciliary body, iris, lens, suspensory ligaments. And here there is retina. Now, here the optic nerve leaves. Students, this point where the optic nerve leaves, here there are no rods, no cones. So if light falls here, there will be no image formation. That is why it is called blind spot. So there are no rods, no cones, no photoreceptor cell. It is the place where optic nerve leaves the eye for the brain and retinal vessels enter the eye. And there is one more point just opposite to lens. This spot in retina. This is called macula lutea. It is yellow colored. And there is a pit here which is called fovea. Actually, retina is thinned out at this fovea. Only cones are present. Sharpest image is formed there. So anyways, blind spot, why it is called blind? Because there are no rods, no cones, no image will be formed. Answer is option C. The pressure on either sides of eardrum gets equalized by. Now we know, suppose this is the external ear pinna and external auditory meatus. This is external ear. Now this will be middle ear, and here there is this tympanic membrane or tympanum or eardrum, lined by skin on outside, mucous membrane on inside. And then it is connected to malleus and incus and stapes. And then internal ear starts. Now, in the middle ear, it's an air-filled cavity, there is a eustachian tube. This is connected on one side to middle ear and on the other side to the pharynx. So, if there is lot of pressure on the eardrum that gets released into our throat through this eustachian tube. So, pressure is equalized, otherwise what will happen? This eardrum might burst, right? So, the pressure is equalized by this eustachian tube. Pinna is what? Pinna just helps in collecting the sound waves. It is present only in mammals. Up till birds, pinna is absent. Although our pinna muscles, human pinna muscles are vestigial. Cochlea is the part which is concerned with hearing in the internal ear. It is here where organ of Cotai lies, and labyrinth is the fluid filled part. The inner ear is called labyrinth. The inner or internal ear. Here answer is B for Bombay. Now, in rhodopsin, the vitamin present is, rhodopsin is the pigment present in rods, visual purple. Iodopsin in cones. Whether it is rhodopsin or iodopsin, it contains retinal plus opsin. That retinal is same in rods and cones, rhodopsin, iodopsin. Opsin structure is a little different. That is a protein. Retinal is an aldehyde. And in both, retinal is a derivative of vitamin A. So in rhodopsin, the vitamin present is vitamin A. That forms retinal, which is a part of rhodopsin. That is why vitamin A deficiency leads to night blindness. Now, far-sightedness is a defect in which? Students, far-sightedness means one person is able to see far off but not near. This is also called hypermetropia. What happens here? The eyeball is shortened. So, the image is forming behind the retina. You want to converge the image and bring it on retina. So, you have to use convex lens. This is what happens in myopia, short-sightedness, near-sightedness, which happens mostly in students. They are not able to see the blackboard, the television far off. Eyeball has elongated, image is formed in front of retina. You have to diverge the light rays to be focused on retina. So you need concave lens. Very, very important, both you should know. Where does lens become opaque? This happens in cataract, in old age. You have to transplant the lens. Canal of Schlemm is blocked in glaucoma. It can even lead to blindness. because aqueous humor becomes more, it pushes, it creates a pressure, and that can even damage the retina and lead to blindness. So this is glaucoma, this is cataract, this is myopia, this is hypermetropia. Our answer is option C. Now, coiled portion of labyrinth is called, labyrinth means internal ear. It has two parts. One is this coiled portion and one is the vestibular part, which has three semicircular canals plus otolith organ, utriculus and sacculus. So this coiled portion is cochlea, and this contains the organ of Cotai responsible for hearing. Three semicircular canals contain cristae, utriculus and sacculus contains macula. This cristae and macula is responsible for balancing. Anyways, answer is A here. Now the posterior pituitary is under. Now students, we know, suppose this is the pituitary anterior and this is the posterior pituitary. Middle lobe and anterior lobe together is anterior pituitary or adenohypophysis. Posterior pituitary is neurohypophysis, right? Now they both are under control of hypothalamus. In the hypothalamus there are neurosecretory cells. Now some of these neurosecretory cells produce two hormones, oxytocin and ADH. And then these hormones comes by axons and get stored in posterior pituitary, and whenever required they are released into blood from posterior pituitary, but posterior pituitary is not synthesizing them. So it is under direct control from hypothalamus because it is getting the hormones from hypothalamus. It is not under control of anterior pituitary, right? What happens in anterior? It is also under control of hypothalamus but indirect control, because here the hormones of anterior pituitary are not produced by hypothalamus, they are produced by anterior pituitary, but hypothalamus produces releasing and inhibitory factors or hormones. They come by portal vein and then they will cause the release, or they will inhibit the release of these anterior pituitary hormones. So anterior pituitary is under indirect control of hypothalamus by portal system, whereas posterior pituitary is under direct control. So answer is option B here. Now oxytocin and vasopressin is stored and released by posterior lobe. They are produced by hypothalamus, not hypothalamic, there is no lobe of hypothalamus and pituitary. They are produced in hypothalamus of brain but stored and released by posterior pituitary or neurohypophysis. Pituitary is called hypophysis. Now diurnal rhythm of body, 24-hour biological clock, it is maintained by melatonin hormone which is produced by pineal gland. It is an ectodermal gland present in our epithalamus of brain. Now tetany is caused by, now we know tetany means hypocalcemia. In the blood calcium level falls, and which hormone is responsible for maintaining high calcium level in the blood? It is parathormone. So if parathormone is deficient, then there will be low calcium level in the blood and there will be tetany, sustained contractions of the muscles. So hypoparathyroidism leads to hypocalcemia, low blood calcium levels leading to tetany. What does this cause? If parathormone is very high, hyper, it will cause more calcium in the blood. From where it will get that calcium? It will dissolve that calcium from the bones. So bones will become demineralized, which causes osteoporosis. Very, very important. Osteoporosis, most common cause is hyperparathyroidism and low estrogen levels in menopausal women. Demineralization of bones, bones become soft, more liable to fractures. Hyperthyroidism, this causes what? Exophthalmic goiter. Eyes becomes protruded out. There is swelling all over. Hypothyroidism, if that happens in childhood or since birth, it is called cretinism. Child will be physically stunted, mentally retarded, sexually underdeveloped, deaf, mute, abnormal skin. And if it happens in adulthood, then it causes myxedema. And if it is because of deficiency in diet, iodine deficiency in diet, then it leads to simple goiter. The thyroid gland gets enlarged in the form of goiter. Anyways, here the answer is option B. Students, the deficiency disease, the hyper and hypo diseases of all the glands that we have studied is very, very important. Direct question comes from that. Alright, so please revise that properly. Now, congenital removal of thyroid will call. Congenital means at birth only you have removed. So, there will be hypothyroidism since birth. Cretinism. Myxedema is also hypothyroidism, but in adulthood. So, answer is not C. And this is hyperthyroidism. So, anyways, answer is option B. Because there will be less T3, T4 secretion since birth. Now, correct chronological order is. Like this also a lot of question comes. How to solve them? We'll go one by one. First gametes are formed, then they will fertilize and then inseminate. No. First male gametes will be inseminated into female reproductive tract, only then they can fertilize. So this is not possible. Gamete will be formed, insemination, then they will fertilize, then implantation of the blastocyst will happen, then childbirth and then pregnancy. No. This is not wrong, correct. This, then implantation, then pregnancy 9 months and then delivery. This is the correct order. Answer is option C. Now, the funnel shaped part of fallopian tube which traps the ovum is, it should be nearest to the ovary. We know fallopian tube has 3 parts according to NCERT. Like suppose if this is the uterus, right? Here is the ovary. Fallopian tube, this is isthmus part, closest to the uterus. Then this largest dilated part is the ampulla. And then this funnel shaped part is the infundibulum. And in this funnel shaped part, there are finger-like projections called fimbriae. So this traps the ovum. So infundibulum. Alright. And where does fertilization takes place? Ampullary isthmic junction. And if that is not given in the option, then you will write ampulla, where fertilization happens. And which part enters into uterus? Isthmus. Now, the layer of uterus responsible for strong contractions during childbirth, the muscular layer, the myometrium. Endometrium is shedded off every month during menstrual cycle. Myocardium is present in heart, not in uterus. And what causes these contractions? Oxytocin. The terminal structure of mammary glands through which milk is sucked out is called. Now students, each mammary gland or breast has 2 types of tissue, glandular tissue plus fatty tissue. If you talk about the glandular portion, then each breast is having 15 to 20 lobes. Suppose I am drawing 3 lobes. 15 to 20 mammary lobes. And in each lobe, there are cluster of cells called alveoli. Like these are the alveoli. Lot of alveoli everywhere. Right? Each lobe has lot of alveoli. These cells produce milk, and in the lumen of this alveoli, milk is stored. Now, these alveoli will drain their milk into mammary tubules. So, there will be many mammary tubules like this. There are a lot of mammary tubules. And all the mammary tubules of one lobe will drain into mammary duct. So, all these will together form mammary duct. Here there will be mammary duct like this. So, all the tubules of one lobe drains into mammary duct. Now, this mammary duct will swollen. It will form mammary ampulla. And then this ampulla drains into a single duct called lactiferous duct. In the ampulla, milk is temporarily stored. And suppose if this is the nipple, areola portion, when the baby sucks the nipple, the stored milk in ampulla will come out of the nipple through the lactiferous duct. So the terminal, the end duct is the lactiferous duct through which milk is sucked out. Clear? So answer is option D for Delhi. Now, all copulations, that means intercourse, do not lead to pregnancy because, students, pregnancy means there should be fertilization between egg and sperm. Sperms can reach fallopian tubes whenever there is a coitus because there is insemination and sperms will reach. But if at that time ovulation has not occurred, there is no egg, then fertilization and pregnancy is not possible. So sperms and egg should at the same time reach that ampullary isthmic junction, that site of fertilization. Only that copulation can lead to pregnancy, right? So it's a line of NCERT, they should be simultaneously transported to this junction. So that is why at around the time of ovulation, if copulation happens, then it is the fertile period, pregnancy can happen. Now during parturition, that means childbirth, the mild uterine contraction that leads to expulsion of fetus is known as. At the end of 9 months, from the placenta, very very important question, and fully formed fetus, these two causes some mild contractions in the uterus called fetal ejection reflex. And this causes oxytocin release from the posterior pituitary. And that oxytocin will cause strong uterine contractions, more oxytocin will be released, more strong contractions, more oxytocin is released. This contraction is in myometrium of the uterus and thus a child is expelled out. So fetal ejection reflex are those mild uterine contractions and they are induced by placenta and fully formed fetus at the end of gestation. Clear? Very, very important. This question comes a lot. Fetal ejection reflex is important. Now, which of the following hormone is not released by placenta? Placenta is a temporary endocrine gland. It releases HCG, human chorionic gonadotropin. It releases estrogen, it releases progesterone, and it releases human placental lactogen, which is like prolactin, helps in production of milk, but it does not produce FSH. FSH is produced by anterior pituitary, FSH LH, gonadotropins, right? And at the end of pregnancy, at the end of gestation, relaxin is also produced by ovary, corpus luteum, that ovary, for relaxing the pubic symphysis. Right, so this is very very important. Placenta secretes these four but not FSH. So answer is option A. Now, the cause of breakdown of endometrial lining is, now we know that in a menstrual cycle, suppose you are starting with day 1 when bleeding occurs for day 5. This is the menstrual phase where bleeding happens and what is shedded off? Endometrium. Why it is getting shedded? Because of decreased estrogen and decreased progesterone, because pregnancy has not happened, fertilization has not happened, so corpus luteum degenerates, progesterone level falls and endometrium is shedded off as bleeding. But mainly because of decreased progesterone, this bleeding happens. Now, after this, follicular phase occurs. That means FSH from anterior pituitary is released. It causes ovarian follicles to develop. They will release estrogen. So because of that estrogen in the uterus, endometrium which is shedded off will be proliferated. So follicular phase, development of ovarian follicles due to FSH, and proliferation is happening in uterus because of increased estrogen. This is happening. Now on day 14, suddenly there is an LH surge, increased LH, and that causes ovulation. After this, the ruptured Graafian follicle is converted into corpus luteum, so it is called luteal phase in the ovary. Corpus luteum is formed and maintained by LH, and this corpus luteum produces progesterone, and this progesterone makes the uterine endometrium secretory. So this entire phase is the luteal phase or secretory phase. And if fertilization has not happened, then corpus luteum will degenerate, progesterone level will fall, and again bleeding will occur. So why there is shedding of endometrium? Due to decreased progesterone level. LH surge is responsible for ovulation. Increased estrogen is responsible for proliferation of uterine endometrium. And ovulation occurs because of increased LH surge. So it is the decreased progesterone. And why it has decreased? Because corpus luteum has degenerated because of lack of fertilization or implantation. Now, Match the column. We'll always go by the options. A can be 5 or 4. Let's see. FSH is not responsible for corpus luteum development. That is a function of LH, maturation of follicles. So A is 5. Now we will check B. LH. It could be 4 or 1. It is not 1. Endometrium is prepared by estrogen progesterone. It is responsible for development and maintenance of corpus luteum. So B is 4. Your answer is solved without even looking at C and D. Let's check. C should be 1. Progesterone is responsible for secretory phase, and estrogen is also responsible for proliferation of endometrium as well as for the female secondary sexual characters, female sex desire, all this. So you must know the male and female hormones and what are their functions. Questions do come on this part. Alright. So here the answer is option A. Now let's see the next question. At the end of second meiotic division, male germ cell differentiates into. Now here they are talking about spermatogenesis. Students, spermatogenesis, oogenesis is again very, very important. Let's see. Suppose this is the male germ cell or spermatogonia. This is diploid 2N. First, it undergoes the first phase, and in this mitosis and differentiation will happen and they will form primary spermatocyte. So they are also diploid. Now this will start undergoing first meiosis. So at the end of first meiosis, 2 cells are produced. These are called secondary spermatocytes. But we know at the end of meiosis, one chromosome number becomes half, so they are haploid. So the first haploid cell is the secondary spermatocyte. Then these two undergoes meiosis 2. They will again form 2 daughter cells. So total from 1, 4 daughter cells are produced. These 4 are called spermatids. They will also be all haploid. And then there is no division. There is transformation of spermatids into spermatozoa. How that we have discussed. So sperm or spermatozoa is formed by transformation of spermatids. This step is called spermiogenesis, right? And then they will bury their head into Sertoli cells to gain the nutrition. Then they will release their head and then they will be released out from the Sertoli cells and seminiferous tubules. That is called spermiation. So spermiogenesis, spermiation and all these stages. Please revise them very clearly, right? So anyways, they are saying that at the end of second meiotic division, male germ cell will differentiate into. At the end of first meiotic division, secondary spermatocytes are formed. At the end of second meiotic division, spermatids are formed. If you write here at the end of first meiotic division, answer will be secondary spermatocyte. If they ask you in which stage second meiosis occurs, it occurs in secondary spermatocyte. But what is formed is spermatids. These are very, very important questions. Which is haploid, which is diploid, how many cells, which is forming. You can just refer to the theory portion. Alright, have a look at this, then we'll solve few more. Students, please also read about oogenesis, the difference between oogenesis and spermatogenesis. Oogenesis starts before birth in the embryonic life. No more new oogonia are added. Second difference is that in oogenesis also, oogonia and primary oocyte are diploid. Secondary oocyte and polar bodies and ovum, they all are haploid. And but in them, the primary oocyte is arrested in diplotein stage of prophase 1 of meiosis 1. And secondary oocyte, when released from Graafian follicle, is arrested in metaphase 2. It is only when fertilization happens, when sperm enters into the, ooplasm, that second meiosis gets completed and ovum is formed. So these are very, very important points. Next is that from one spermatogonia or one primary spermatocyte, 4 sperms are formed, whereas in oogenesis from one oogonia or one primary oocyte, only one ovum is formed because the other 3 cells will be polar bodies. So just revise that concept. It is very important for questions. Now, which of the following organ is differentiated first during development? We know at the end of 1 month, heart is formed. So it is the first differentiated. By the end of 2 months, limbs and digits form. By the end of 3 months, almost all the important organs and organ systems are formed. During 5th month, the mother is able to feel the fetal movements, fetal kicks, and hair on the scalp of fetus appears. During 6th month, hair all over the body of fetus appears, eyelids separate, eyelashes are formed for protection of eyes because eyelids have separated. And by the end of 9 months, the complete fetus is formed. Alright? So answer is option A here. Now, which is correctly matched? This question has already come in NEET. Let's see. Menstruation is breakdown of myometrium. No, endometrium. Ovum is not fertilized, definitely. That is why corpus luteum has regressed, progesterone has fallen, and endometrium is broken down. So this is false. Ovulation. LH and FSH attain peak. No. LH. FSH is also peak. Actually, FSH, LH both have mid-cycle peak. Sharp fall in the secretion of progesterone. No. After ovulation, corpus luteum is formed, so there will be a rise in progesterone level, not a fall. Now, development of corpus luteum happens in secretory phase, yes. It is called luteal phase because in the ovary corpus luteum is getting formed and it increases secretion of progesterone. So, secretory phase happens in uterus. So, all are correct. This is the correct answer. Let's check. This has to be wrong. In proliferative phase, there is rapid regeneration of myometrium. No, it is endometrium that is regenerated. And maturation of Graafian follicle, yes. But overall, this statement is false. So, overall, the correct statement is option C. Menstrual cycle, oogenesis, spermatogenesis, structure of sperm, these are very, very important. Now, the program of family planning was initiated in the year, it's a direct question, in 1951. India started this family planning program, which is now called RCH, that is Reproductive and Child Health Care Program, RCH. The full forms are very, very important. Answer is option D, it's a direct question. Now, statutory ban has been laid on the following to check female feticide. Feticide means killing of the female fetus inside the uterus womb of the mother. We know, students, this extra embryonic membranes are also important. Please revise about amnion, chorion. I have discussed that in theory. Suppose this is the fetus, this is the umbilical cord. Around the fetus there is this amnion and this is the amniotic fluid which prevents desiccation, which prevents the fetus from shocks. Now what happens? We know that in this amniotic fluid there are pluritotipotent cells. So if suppose we are suspecting some kind of genetic abnormality around 14 to 18 weeks of pregnancy, the lady is given a little local anesthesia and with a needle this amniotic fluid is taken out and this is analyzed in the laboratory. So you are able to see those cells. In each cell there will be 46 chromosomes, so you can see the karyotyping, you can see the pattern of those chromosomes. If suppose there is Down syndrome, at 21st chromosome instead of 2 we will have 3 chromosomes, so that suggests trisomy 21. There is no meaning in giving birth to such a child, so then abortion is suggested. So you know, like this you can see all the chromosomes, 46 chromosomes and their patterns and you know some mutation, everything you are able to see. So this is very useful in detecting genetic abnormalities, chromosomal abnormalities, but many a times couples, doctors misuse it. They are also able to see, since they are able to see 46 chromosomes, they are able to see whether it is XX or XY. And if it is XX, female child, female fetus, then they get it aborted deliberately, which is a crime. So now there is a ban, not a complete ban, a statutory ban. Only if indicated, if there is a history of some genetic abnormality, chromosome abnormality, we are suspecting something like that, then specialized centers can perform this amniocentesis. Just for the sake of knowing the sex of the child, it is banned. So amniocentesis performed between 14 to 18 weeks of pregnancy for genetic or chromosomal abnormalities detection. Answer is option B for Bombay. Now, a natural method of contraception. We know, students, there are artificial and natural methods. In natural methods, we have read 3 main methods. First is abstinence method or calendar method or rhythm method. In this, during the time of ovulation, ovulation happens on 14th day. So 10th to 17th day, if the couple avoids the sexual intercourse, then there is no chance of meeting sperm and egg simultaneously, and there is no chance of fertilization, no chance of pregnancy, acting like a contraception. But a lot of willpower is required, although and cycle should also be regular, otherwise the couple will not know when the ovulation is happening and this will fail. Second method we have learned is withdrawal method. In this, the penis is withdrawn from the vagina before ejaculation. Again, lot of willpower is required, and even pre-ejaculatory semen also contains some sperm, so still pregnancy can happen. And third method of natural contraception was lactational amenorrhea. Post-delivery up to 6 months, if a lady is nearly exclusively breastfeeding the child, prolactin levels are high, that suppresses FSH-LH, ovulation is not happening, periods are not coming, menstruation is not happening. In such a lady, because ovulation is suppressed, that acts as a contraceptive, but only up till 6 months. In a non-menstruating female, if she has got her menstrual cycles after 2 months of delivery, then lactational amenorrhea is not valid as contraception, because she is getting menstruation, that means ovulation is happening, FSH-LS is getting formed, then there can be pregnancy if coitus happens. So these are the three main methods. So they are asking about periodic abstinence. The first one, there is abstinence of coitus from 10th to 17th day of the menstrual cycle. Alright. So we'll do few more questions in the next class. Up till now we have discussed the most important 100 questions. I am again repeating, the question might come as such or nearer to the topic which is discussed in the question. Alright. So just start revising your theory, just go for it, and see you in the next class. Till then, a very happy learning and have a good day. Thank you.